let's bring in Cody Oselett. He's the business development manager for Yaldo Eye Center. Cody, thank you for being with us. Our apologies for running a little bit behind.
That's all right. Thank you so much for having me.
So, with that, Cody, tell us more. We're more than a year into this. How is the team at Yaldo Eye Center doing right now?
It's made us adapt a lot. To first start out, we were deemed unessential. That is optical. So, selling
Really?
glasses.
I
Yeah,
would think
yeah.
you'd be essential.
Now the medical side of things, as far as uh, eye emergencies, we're open for those certain type of emergencies. But when it comes to cataracts or LASIK or glasses, we were completely closed down for quite some time. And then coming back, we had to re-engineer how we did things safely, and it made us adapt and it made us better, and it's been good.
And so, with that, you are back open. Are you seeing an influx of patients right now? Because we're all spending way too much time staring at our computer screens.
I would say there's multiple reasons. Number one reason is people no longer want to have their glasses fogging up from the mask. That's a huge one for
How do
like
you prevent that, by the way? Do you have
get
a
LASIK.
secret?
Yeah, get LASIK, and we'll get you out of glasses. Or multiple other options. That's one thing that's really driven us. Obviously, I think the pandemic has made us realize that the things that we deal with in every day, there's ways to change it. That's why the housing market's so crazy. We want to be in the house we want. Maybe we're over glasses and over touching our eyes, dirty eyes or with dirty hands. So we want LASIK. So I think it's opened our mind to really getting what we want, and our industry's fallen into that.
We're talking with Cody Oselett. He's a business development manager for Yaldo Eye Center. We do know that you're pretty well known here in the Metro Detroit area. Um, when people are thinking about trying to have LASIK, what advice do you give them on your team?
So just to make it clear as well, we do LASIK, cataract surgery, and then a multifocal implant. Anytime that where you really want to start, as far as LASIK goes, that's the people that really just need to see distance wise, and we would just have them go to our website, fill out a questionnaire, and it'll lead you to the right path. But then there's people, once you get to a certain age, we need help with reading up close and mid range as well. So we have an option called a clear lens exchange. Once again, that questionnaire will kind of get you there. And then cataracts. Everyone ends up getting cataracts. We do cataracts. Dr. Yaldo is one of the leading people for that. So once again, yaldoeyecenter.com. We have a questionnaire that'll lead you in the right direction and get you in for a free evaluation.
So, with that, we do know that it's not just adults, but also kids are staring at their screens so much more. When do parents know that they should take notice as to changes in how their kids are viewing the screen?
Well, usually the primary eye care, physician is going to be able to determine with some tests when they're younger if they need glasses and whatnot. But as far as the screen usage goes, there are blue light lenses out there that can help. I can see the tint of blue coming off your glasses. Your non-glare has it, and that makes a big difference as far as filtering. But as far as noticing a difference, I think we're going to see an influx of dry eye from people being so close to the computer screen and whatnot. Those tall tale signs, the kids itching their eyes, things along those lines, get them in and we'll take care of them.
So I have to ask you, I know it's kind of an old wives' tale, but I know you're not a doctor, but is there anything to the old adage like, don't be so close to the TV? Because we're all binging Netflix right now. But I remember growing up and your mom saying, move away from the TV, you're too close.
Well, I think part of that was like they thought radiation came from TVs back in the day, like microwaves, and that is completely not true. But as far as your eye goes, yeah, any type of eye strain you're doing, I don't know if you ever realize if you watch a kid watching TV, they don't blink for like 30 minutes. And that is terrible for your eyes. So, yeah, there is something that goes along to it. Obviously, playing outside is better, but if they're going to have to do it, I guess moving back and then setting time limits.
Cody Oselett with us here on the MegaCast. He's a business development manager for Yaldo Eye Center. And with that, Cody, if I can ask you, when we're talking about LASIK, what is the procedure like and what is the recovery like?
Nowadays, technology's came so far. It's all custom treatment based off of the scans that we do when you come in for your evaluation. The whole procedure takes about 10 minutes, which is amazing. It's quick, seamless. A lot of people, if we do our procedures on Thursday, they're back to work and good to go on Monday. You could even start the next day, but we tell you to, take a day off. It's amazing. I used to be an optical for a long time. So what I meant is I sold glasses, and that was great too, because glasses give people confidence and they look nice. But the fact that I see people who wake up every day, can't see the alarm clock, after a 10-minute procedure, they come in the next day and they're 20/20. It's amazing, and it's really life changing.
Yeah, I will say, you hear the stories about as soon as you hit 40, you're going to need glasses. No way. But I have actually gone to buy things and the price was different than what I thought it was because I couldn't see. And then it was like, okay, at this point in
Doing
time,
the arms too far away thing. So
yeah.
we have a thing for that real quick. There's LASIK, and then we have a thing called or a procedure called clear lens exchange, where we're doing your cataract surgery early for you, even though they're not ripe enough. It's a little bit more expensive, but what it's getting you is near or mid-range, and then also distance. So we're giving you perfect vision for the rest of your life, and you no longer need cataract surgery. Great procedure. We're really pushing it, and we've had a lot of good outcomes.
Well, I will say too, I found a salvation for not being embarrassed to pull out my glasses. There's an app on your phone. It's a reading glasses app. So you can just pull it out and you look like you're on your phone, but you're really,
I like your glasses look great though. I'm sure they're multifocal.
So with that though, Cody, if I have to ask you, if I can ask you, I did work with Jessica Starr at Fox 2, and we know the tragic story with Jessica in that she did have eye surgery. She wore contacts for years and wanted to get rid of them. And she was, I think she did a new procedure, which was called Smile. And I forget what that stands for. But sadly, because of the complications from the eye surgery, she ended up committing suicide. So her family believes. How much has that impacted, or at least opened up the dialogue for the team there at the Yaldo Eye Center?
Well, being as compassionate as possible, there's, I think, a lot more to what causes something like that to happen. We're in the name of changing people's lives for the better. We see phenomenal outcomes, and really allow people to break away from their freedom from that. Could there be more that was going on elsewhere for her situation? I think that might be the case. How did it impact us? I know for a long time it did impact us greatly. It's something that was really sad, and I think it was taken very far, on purpose, because something like that, it's very tragic. But with that being said, I think it takes a lot from us by doing evaluations, making somebody. We take a lot of steps to make sure that somebody is a good candidate. We make sure they're going to have a good outcome. I can't speak on her care because it wasn't with us, but I know that the determination that Dr. Yaldo and our team does to make sure that you're a good candidate, you're not going to have complications or anything in the future. That's really what makes a difference. Anyone or any eye surgeon can do procedure, but taking those initial steps, being diligent, being conservative, gets us good outcomes. It makes people happy, and that's really what we try to focus on and take care of our patients.
Yeah, and it really is, have a conversation, with your healthcare provider. And, a lot of people are having these conversations, not just about LASIK, but we're also seeing it right now about the vaccine. And it's important to be informed on these medical conditions and know the risk and the dangers and whether or not you're able and willing to be able to take those. And I know I'm quite certain that following her death, because it was here, while it made national news, it definitely hit us here close in Metro Detroit, but it opened up the conversation, which is always a good thing, is to have the conversation between yourself and your healthcare provider. So with that, Cody, too, when should people know if the decision is right for them to try to get LASIK or not?
Are they sick of wearing glasses and contacts? That's the number one. Or do you want to see when you wake up? Next, I would, book evaluation with us. What our doctor's going to do is look at the overall health of your eye, make sure that you meet all the criteria. Look at your prescription that has, sometimes uh, a impact on whether or not you can have procedure. Then look at lifestyle. What do you do? There's certain procedures that we can't do in a truck driver because he needs, perfect distance vision. I can't help him with his up close sometimes, but there's other options like the clear lens exchange where we can. But what I mean is look at your occupation. Are you looking at bright lights all day? Are you have a risk of dry eye or working in a facility where maybe there's a lot of steam or something? There's a lot of things that we can do to make sure that you're a good candidate, and we have multiple procedures to determine that as well. I'm confident in my team and Dr. Yaldo that we're going to get every one of our patients a very good outcome. We're going to make sure that we're looking at health before we look at what the patient wants, and then we'll take it from there.
Cody Oselett with us here on the MegaCast. He's the business development manager for Yaldo Eye Center. If people want to find out more or more information, or maybe even to book a consultation, how can they do so?
Please head to yaldoeyecenter.com. You can see the consultation form there. We have a little bit of a questionnaire. Then also all of our social media, we have, a bunch of reviews to take a look at, or ask around. Once you start asking around, you got to know someone who's had LASIK and had it done by Dr. Yaldo.
Right. And, for so many of us in the pandemic, we are using our eyes differently right now because we're in front of the TV so much more. We're in front of the computer screen so much more. And we realize that, our eyesight is so important. So we need to take care of our eyesight as well.
Yes, very much so. I mean, I think it's made us realize that we don't want to settle for a lot of things. So if we can get you out of glasses and contacts and make you feel more free, it's definitely a good step to take.
I will say, Cody, before I had to wear glasses, I was one of those people, you were kind of jealous of people with glasses, right? Do you remember, a few years ago, it was really big to get glasses with the fake lenses in them?
Yeah, but that's because we didn't need them. When you have to
Right.
rely on them and people have to go on vacation and remember to bring multiple pairs of glasses or wear contacts or think about going in salt water with contacts on. There's so many things that people that don't need glasses don't realize what others go through that do. And it's a hindrance in some ways, but they can also make you look really good too. So there's a fine balance.
They can be stylish, but they're also a pain when you have to do interviews all day because the lighting, we're constantly fighting with the lighting here to try to get rid of the glare. It's constant, and we're all feeling it right now.
Yeah. That's a big one as well.
Well, Cody, we so appreciate your time today.
Yeah, thank you so much. I really appreciate you guys having me on. Once again, yaldoeyecenter.com. Also, please reach out to me personally, LinkedIn or wherever it is. I can get you, in contact with who we need to have you talk to get procedure done.